a great live Q&A for you today. If you've got nutrition questions, hopefully I have some good nutritional answers for you. You can type those into the chat or the comment section, and I'll do my best in the next hour to get those answered for you. Now, in addition, if you're new to the show, welcome aboard. If you'd like to get some free information about how you can navigate chronic inflammation with diet and lifestyle, I'll encourage you to go to Gluten-Free Society, our website, and sign up there for our free newsletter, and we'll send you out a ton of free information on how to navigate health through nutrition. So let's dive into your questions. Why is having blood sugar fluctuations dangerous? Dennis is asking. So it's not that having blood sugar fluctuations is dangerous. I think it's having blood sugar fluctuations over time. So if your blood sugar is really ramped up because you eat high carbohydrate based meals and you elevate your blood sugar and you multiply that over many years, and you're also not exercising and sleeping well, and you're also malnourished, now those blood sugar elevations or spikes become longer spikes, and then subsequently they become prediabetes and diabetes. So it's the long-term game. But just eating a higher carbohydrate, let's say you were going to go do some exercise, and so you wanted to fuel your body and have higher carbohydrate, you got a glucose spike before exercise, and then you went to exercise to burn that off. That type of fluctuation is really not dangerous. So in part, it depends on the type of fluctuation you're referring to. I've had osteoporosis for several years, and I'm 55. I take a lot of your supplements. Do you recommend your bone box too? I work out hard 3 to 4 times a week and walk every day. Any suggestions? I mean, it sounds like you're doing a lot well. If you are taking supplements from, if you've done our nutritional testing, like if you went online and bought our nutritional testing to determine what supplements you needed, then there's no additional need to also take like our bone box formula. Our bone box formula is more for somebody with clinical osteoporosis, and they're trying to support general bone mineralization and bone growth. So if you've already had customized testing to determine nutritional deficiencies, it's not so much of a need to take that bone box. But those of you who are not getting testing done, the bone box is a fantastic way. As a matter of fact, our data on the bone box shows improvements in bone mineral density over time. So something you might want to look at or look into. I think we have a link under the video with that. But also, if you missed Tuesday's show, where I did a deep dive on bone loss and osteoporosis, I encourage you to check that out. Let's see here. Is there a way to boost melanin for those who are naturally low in skin pigment? Does this increase brain melanin too to get sunshine? I mean, yeah, the best way to boost melanin is, one, you need to make sure you have enough B12. You need to make sure you have copper. You need to make sure you have the amino acid profile, a healthy amino acid profile, because melanin is based on or made off of amino acids. But outside of that, it's sunshine. Sunshine is going to be your most important variable factor for improving your melanin production. Every time you get sunlight, that sunlight hits your skin, it triggers the pigment producing cells to make more melanin to protect you from the sunlight, right? But the key there is slow, steady, consistent sunshine, not going out to the beach for several hours and getting a sunburn. That's the wrong way to go about trying to increase your melanin. So building your tolerance to sun by being exposed to low doses frequently, and then increase your dose accordingly. And yes, that is absolutely the best way to build melanin. I love, let's see here. Had one infusion of a biologic on February 21st for a severe colitis flare. Now, as it washes out, I have severe joint pain. Is there a correlation? Yeah, there absolutely can be, Dahlia. So So first of all, there's a correlation between ulcerative colitis and other autoimmune joint diseases like rheumatoid arthritis. And oftentimes the one of the potential triggers behind ulcerative colitis and joint pain is something called a lipopolysaccharide. Now, what is that? That's a bacterial toxin. There are certain species of bacteria like Klebsiella and Pseudomonas bacteria that produce these toxins, is what are called endotoxins, that can trigger UC, but also can trigger joint pain. And when you take a biologic and you suppress the inflammation, you suppress your immune system, and subsequently you suppress the inflammation. When that starts to wear off, symptoms can come kind of roaring back for some people. So not to say that you need to, not see your doctor and stop your medication, but you need to investigate the potential for diet and the potential for the microbe, the different types of bacteria. We also see that happen with yeast, because if you don't deal with that, you're going to be limited to having to go back and get that biologic repetitively. And the problem with biologics over the long haul is they can increase the risk for the development of cancers, and you don't want that. Just look at the black box warning label on that medication. Talk to your doctor, your pharmacist about those risks. They're very real risks. And so you want to do everything you can to alleviate the triggers of your issue. What are the 4 categorical triggers of autoimmunity? Number 1 is food. So you need to get tested for food. Number 2, nutritional deficiencies. You need to get tested to see what you're lacking. Number 3, microbial imbalances, like those bacteria and fungus I was just talking about. Those can be triggers. Number 4 is, very simply put, oh man, I hit a brick wall in my head. So food, chemicals. Sorry. Chemicals are the 4th trigger. So getting tested for things like food dyes, food additives, preservatives, things you might be using in your soaps and shampoos, things that might be in your food that are inadvertent if you're eating processed food. Like, looking at those things becomes the paradigm of your way forward. And if you're not doing that, then really you're going to have to manage the ulcerative colitis with medication, which, in my opinion, that's not the best of things. What's the best food for dietary fibers? Jessica's asking. So dietary, it's not a best food. I think there's plenty of fiber in lots of different types of food. If you're eating a variety I would say, if you're eating a variety of vegetables, you're going to get fiber. Now, some of you don't do as well with vegetables. Some of you with gut dysbiosis, or some of you with leaky gut, and you're not tolerating vegetables as well. And some of you are allergic to certain kinds of vegetables. So it depends on the person. There's not a one fiber trumps all. It's just more, try to eat a diverse array of foods seasonally, organically. That's your best bet over the long haul. I've had a severe allergic reaction to a weed or plant in my yard. My whole body has severe itching with hives. What can I take to help with the itch? You could always take over-the-counter Benadryl if it's that severe. Again, not say that that's my go-to. If it were me, we have 2 things that I would personally use. Number 1 would be something called DAO, Ultra DAO. It's an enzyme that degrades histamine. And so when you have hives and itchiness, it's histamine that's causing that. So this is a supplemental enzyme you can take, and it will degrade histamine. Number 2 would be, we have a product called HistAssist, which has a multitude of different ingredients that work synergistically to help stabilize the membrane around the cells that make histamine, so that you're reducing the potential for histamine release. So the combination of those 2 things is what I keep in my natural home medicine cabinet for that type of occasion. Mickey says, I have an appointment with you June 24th. I'm so excited to meet you. That's awesome to hear, Mickey. I can't wait to meet you either. Thanks for having faith and confidence in our practice to come join the team. Lori says, I have osteoarthritis, had 5 joint surgeries, and dealing with moderate chondromalacia, told to do PT, then possible MRI. Pain and fatigue is terrible. So 5 surgeries. So there's context to that. So I'm going to talk for a minute, Laura, to maybe give you some of what I mean. So 5 surgeries, and what was the quantity of time? So if you had 5 surgeries over the course of 5 years, or did you have 5 surgeries this year? I don't know the answer to that because that wasn't part of your question. So that's part, for me, that's context, because if you've had surgeries, several surgeries in a shorter period of time, what that does is it sets you up for nutritional deficit, right? Because every time you have a surgery, it's a scheduled trauma, right? The surgeons are cutting into you. They're, you know, especially if they're putting implements in, like metal devices or screws or that type of thing, all that's trauma. All that's going to damage your tissue, and your body has to heal and repair that damage. That requires more protein. That requires more vitamins and minerals in order to do that. So if you've had 5 surgeries and they're not working and you're not recovering well, the number one thing that you should be doing is getting your nutrition status checked. We can put a link below the feed for you, because several of you have asked about that, to get nutritional testing done. Because yeah, you can ask your doctor, but the reality is, you know, the vast majority of medical doctors have 0 training or minimal training in nutrition. When you ask them to do nutritional testing, they say no, or they say it doesn't matter, or it's not important, or they say your insurance won't cover it, or they say, if they do it, they order what's called a serum test, which is inaccurate and not the best way to determine deficit, right? So we've actually put nutritional testing and made it available to people through Gluten-Free Society. Again, I'll put a link up to that, and you can go get that done. We measure over 50 nutrients, all your vitamins and minerals, plus other key nutrients that are important for recovery from surgery. Now, beyond that, we do have a pre and post nutritional surgery support protocol. We can post a link up as well to that protocol, and that's something else you could get started with. If you're in a lot of pain, and it's been chronic, one of the best ways to deal with chronic pain is taking SPMs. And we have a product called Ultra SPM. SPMs help to resolve inflammation. So for the person that's had chronic inflammation, they're just not recovering. This can be a very, very effective way to help with that. Now, all that being said, ultimately you have to figure out, you know, what's going wrong for you to need so many surgeries. And so if you're doing something wrong, if you're eating the wrong food, if you are, you know, there's 6 fundamental things that we like to make sure people are educated about: the right food, sleep, exercise, sunshine, clean air, clean water. Those 6 things are your staple of decisions that you make over the course of your lifetime to ensure that you are trying to optimize your health. And if you think about those 6 things and you're like, I'm not sure if I'm doing this one right, or doing this one well enough, or doing this one enough, you've got to start changing those behaviors, because at the end of the day, you know, supplements are not the long-term solution. They're a supplemental adjuvant to making great decisions over time, right? Supplements can help certainly dig people out of a hole, but if you don't change your behaviors, you know, you're going to have a disappointing future as far as how you feel. What impact does arrowroot powder have on the skin microbiome? Would it feed candida on the skin or help get rid of it? Nobody knows. Nobody's done, as far as I'm aware of, Melinda, nobody's done any research to help to ascertain that. And it's a good thought as far as that. I've seen many people apply arrowroot in their deodorants and not have problems with yeast overgrowth. So like my own personal and clinical experience would be that I wouldn't imagine it has too great of an impact on the microbiome overall. But everyone's unique and different in that regard. What are your thoughts on boron supplements? I think boron's very important. You know, Candace, have you watched my crash course on boron? It's about an hour long, but I do a super deep dive on the importance of boron. Now, you can get boron from food, but you know, there's also, depending on where the food was grown or where the cow was grazed, etc., certain soils have more or less boron, and so puts people at risk depending on where you live for boron deficiency. For example, in Turkey, the country Turkey, they have more boron in the soil there than anywhere else in the world. And so this boron deficiency there is not a high likelihood. But here, well, the worst place to live is the Caribbean if you're talking about boron, almost no boron content in the soil there. Let's see. I'm from Ireland. Hannah says, hi, Dr. Osborne. I'm from Ireland, and my doc has never heard of the HSCRP test. Oh, gosh. Just the regular CRP test. What's the difference? Sensitivity. I mean, HS stands for high sensitivity. It's more accurate. The biggest difference, Hannah, is you can run a CRP if it comes back normal. It doesn't mean you don't have inflammation. That's why we use an HSCRP instead. It's more sensitive. It can pick up on inflammation more readily. So that's the main difference. If your CRP is normal, then you may not mean that. You may just, if you don't do an HSCRP, you could miss it. Is the point. Now there are other tests that maybe your Irish doctor does have in their arsenal that may also detect or pick up on inflammation. You might ask about TNF alpha, tumor necrosis factor alpha. You might also ask about erythrocyte sedimentation rate, or sometimes called SED rate. You might also ask about ferritin. Ferritin is an acute phase marker. If it's elevated, it can indicate acute inflammation or chronic inflammation for that matter. And you may also ask about homocysteine. Those are other inflammatory tests that are typically available in a regular or standard doctor's office visit. I'm getting 2 infected root canals removed and doing bone grafts. I have Hashimoto's and leaky gut, and I'm afraid I won't heal well. Will the bone box help me a lot? Also, would it help my cavities? Possibly. Laura, I would say if you're getting 2 root canals removed and doing bone grafts, definitely the bone box, but you also will want to look at our surgery protocol, because when you're tearing open gums, you're going to need more. I would definitely make sure you're getting enough protein, but you're going to need branched chain amino acids, ideally glutamine, to increase your vitamin C level, because all those things are going to be necessary for that gum tissue to heal back up successfully. So if you're worried about whether or not you're going to heal, definitely. Will the bone box help with cavities? Yes, in an extent. There's many nutrients in the bone box that can help with the health of your teeth. So it's hopefully you're not moving forward with more cavities, right? Because cavities are very preventable. Probably the biggest thing we see drive cavities is the wrong food. Gluten actually creates an autoimmune reaction against the dental enamel on your teeth and can contribute to severity of cavities. Do you recommend removing gluten during perimenopause? It's one of our TikTok folks. Ben to Bean. I recommend testing for gluten and removing it if you are gluten sensitive. It's a genetic test. If you are interested, you can go to glutenfreesociety.org. There's a tab for lab testing and look at the genetic testing there and get that done. If it comes back positive, then it'd be a good idea to get gluten out, whether you're in menopause or whether you're not in menopause. So to me, the age or the stage of life is not so relevant as to who should remove gluten so much as it is, are you gluten sensitive? Now, you can also take our quiz. If you go to Gluten-Free Society, there's also a quiz, a gluten quiz you can take there. And you just click the button on the quiz link and it'll ask you a bunch of different questions. And, how you answer will help determine whether or not there's a suspicion that going gluten-free would be the right move for you. But that's a novel quiz, and it's not necessarily a confirmation. The genetic testing is one of the best ways to get confirmation. Doctor recommends wife get a pacemaker implanted. Your thoughts on this? I mean, that's not enough information for me to give you great thoughts, Robbins. Because there's a lot to that. Why is he recommending a pacemaker? What's her diagnosis? What's her problem? What's her history? There's a lot to unpack there. Now, I can tell you this, if it's AFib or if her heart has an electrical imbalance, a lot of people with those types of symptoms, we've seen people where they get that recommendation of a pacemaker, but many of them they don't want to do that. So they opt out and say, no, that's just not something I want to do. And they change their diet and their nutrition, and their problems improve. Now there's a potential possibility that that could be the case, but I just don't know enough context around it to again, don't take this to construe this as medical advice for her to not go get it done, but explore the potential for nutrients and their impact on the heart. And I've done shows on our YouTube channel. You can check out our library there, our crash course library on cardiovascular problems and nutrition that might give you guys some insight. I've been grain-free for many years now. I'm working on my nutrient deficiencies and staying away from food I can't tolerate. I work out a little and I don't need to lose any weight. My problem is my belly is always swollen, no pain, just big like I'm expecting. I'm 65. What should I do? Get your gut microbiome tested, because one of the things that we see very commonly when people are swelling, this is gas formation that's occurring, and it occurs as a result of what you're eating. A lot of times people develop food intolerances, or they have the wrong kinds of microbes growing in their gut that anytime they eat certain types of foods causes intestinal gas formation that leads to this kind of pregnancy belly or bloated belly. So knowing what your food reactions are, but also knowing what your microbiome looks like are going to be two very important components. You might also consider, digestive enzymes. You might consider taking stomach acid. We have a product called Ultra Acid, which is basically just helps with digestion. If you don't have your gallbladder, you might want to consider, we have something called Lipogest, which helps you to digest, because sometimes it's also where you're not making the digestive fluids. And so when you go to eat, you're not digesting well, and those microflora that live inside of you are helping you digest. And the byproduct of that is gas and fermentation, which creates an extension in the belly. So those are all possibilities. What is the impact of sunshine on Parkinson's disease or simple tremors? I mean, sunshine is a necessity for anyone, whether they have Parkinson's or not. I wouldn't use sunshine as my first line defense with Parkinson's. If somebody came to me with Parkinson's, I wouldn't say, we're not going to do anything else. I just want you to go in the sun, because we're not going to reverse Parkinson's with sunshine. That being said, Parkinson's is a neurodegenerative disease, and vitamin D plays a critical central role in maintenance of nerve sheath and maintenance of nerve tissue. So sunshine is going to play an important role. It's just probably not going to be the only thing that needs to be done for that person. Parkinson's is autoimmunity. So investigate food, chemicals, microbes, and nutritional deficiencies as a starting place to make great decisions about how to overcome it. What would you advise a 2-year-old who was born with eczema and chronic hives and now has developed asthma, graying hair patches, and vitiligo? That 2-year-old is malnourished, most likely, if they're developing graying hair patches. That's a very common sign of protein malnourishment, Shalene. This is so much so we actually have a name for it. It's called the flag sign. So this is the lack of protein. So it can also be lack of B12 or lack of B5, which both come more in protein. But with chronic eczema and chronic hives, these are immune responses. So oftentimes when people are protein malnourished, their immune system is not as pliable, and so they become more allergic to many things. And this is where hives come in. These are allergic responses, histamine allergic responses. So I'd look at the diet and see, are there ways that we could improve on the protein intake? A lot of kids today, this is no accusation to you or any other parent who's just trying to love their children and do a good job, but a lot of parents are undereducated about nutrition, and they just, they're getting their education from the same forces that don't know much about nutrition, that are just trying to sell you stuff. And that's unfortunate, but kids need protein. And also a lot of parents are moving more away, or kids have texture issues, and so they're choosing not to eat the protein, and the parents are letting them eat foods that are low in protein. And then what happens is the nutritional consequences sneak up. Now, outside of that, eczema, hives, and vitiligo. Vitiligo is an autoimmune condition We got to think about gluten anytime we think about any form of autoimmunity, gluten sensitivity, because it's one of the primary it's the most well-documented, well-studied cause or driver of autoimmune disease. So you always have to consider gluten. But I would also, in this situation, consider mold. One of the things we see in babies is chronic hives and eczema is a lot of mold, especially when you add the asthma to that equation, which I think you'd mentioned asthma was one of the symptoms as well. So could be mold exposure, definitely some issues with diet, gluten, and protein are all avenues that I would start investigating. Is there a too much when using TENS to manage gnarly chronic pain in the spine for hypermobile Ehlers-Danlos? Back and down on heating pads and back is splotchy from the heat. Do PT and exercise, supplements, avoiding the drugs? Thank you. So, I mean, TENS can you do too much? Yeah, I mean, if you lie on the TENS pads, if you're lying on your back and the TENS pads are adhered to your back and you're lying on that, you could actually burn the skin. So yeah, that's where really you have to be careful. But it's, what happens the longer the TENS unit is on, the more sensitized your nerves become to that. And so generally speaking, you have to turn the volume up and turn the volume up. And so the worst kind of danger, if you will, of using TENS at too high of a dose is really just burning of the skin. So you just have to be careful with that. What is the impact on the bones of a vegan diet for friends who eat this way? So, I mean, it depends. Some people, well, if you're talking about vegan, I don't recommend vegan. Now, vegetarian's a different matter, but vegan diets, in my opinion, no one should be on a purely vegan diet. That's just my opinion and my experience clinically. And I've been practicing for 24 years. Purely plant-based diets are incomplete. There's not enough B12. There's not enough zinc. There's definitely not enough protein. And specific, there's not enough methionine and glutamine and branched-chain amino acids in a purely vegan diet. And so the impact is potential bone loss. There's also not enough of the fat-soluble vitamins in vegan food. So like you're going to be tremendously lacking vitamin A and vitamin D. Both play a critical role for bone health. You're going to be lacking vitamin K2, also critical for bone health. So yeah, just not, I mean, I'd say if you're following that kind of diet, no offense to you, but I would encourage anyone following that kind of diet to every 6 months get nutritional levels measured and supplement accordingly. Because if you're going to be on a restricted diet, you want to keep tabs on those restrictions having the potential to cause vitamin and mineral deficiencies. Any idea why a woman of 66 can't empty her bladder? They did not find anything blocking the bladder. She needs to use a small tube multiple times a day to do the job. She also tried specific exercises and that did not help. She's not grain-free. Well, I mean, that's a great place to start. One of the things that we know can drive irritation to the bladder and inflammation in the bladder is gluten. Also, oxalates can do it. It's very common to see people with that type of issue have a reaction to either one of those things. I'd also look at minerals, especially in the realm of electrolytes, because if she can't contract and relax her bladder appropriately due to something like a calcium or a magnesium deficiency, then that could also be contributory. Let's see here. What are the different types of CoQ10? Which do you recommend? It's less about which I recommend and more about the form of CoQ10. So ubiquinone is what you're looking for. If you see the term ubiquinone, that's what you're looking for. And then the next part of that question was, should you take PQQ with CoQ10? You can, but it's not a requirement. You should check out my crash course on CoQ10. A full deep dive, all you ever wish you needed to know about CoQ10. Does eating gluten-free resolve the negative bone impacts of gluten sensitivity? It can. I mean, one of the side effects of gluten is osteoporosis. I actually had a case one year as a woman. There's several cases like this, but one particular patient comes to mind because she had gluten sensitivity, celiac, where it was so severe that she had spontaneous fractures in her thoracic spine. So she just had vertebrae that were collapsing. And it was so painful for her, and she had a new baby. She couldn't, and this was because the gluten was damaging her gut so severely, but she was also pregnant. And so she went through pregnancy malnourished. She wasn't absorbing the minerals necessary to keep her spine, mineralized. And so after giving birth, spontaneous fractures of her spine. It took every bit of 18 months to get her, we got her in the pool. We got her nourishment back up. We got her gluten-free, and she made a recovery, and she's now functional. So can going gluten-free reverse the damage of bone loss? Yes, it can, but you've got to get to it in time. You've also got to be willing to do some of the other things, because when you're dug into a hole of malnutrition, very often supplementation at higher doses becomes a necessity to recover somebody who's dug that deep into that bone loss hole. Latticed retina with a history of retinal tears, anything to strengthen the retina, lots of vitamin A. Look at our formula called Focus, Focus. We'll put a link up for you. It's basically, the formula is eye nutrients. It's for the eye, for the retina, for the eye. So if you're looking to support that nutritionally, that formula that blend is for that. Jane says, thank you for so much for all your amazing work and advice. I live in Canada, extremely hard to get a doctor. I have multinodular goiter. How can I shrink it? Well, I would say this, Jane, if it's a hard time getting a doctor, call my office. We can put the number up for you. We do telehealth consultations with folks, and so don't let that that geographic distance inhibit your ability to get the nutritional guidance that you need. Now, about your question about a multinodular goiter, it depends. There are a lot of potential reasons that could be driving that: iodine deficiency, selenium deficiency, vitamin D deficiency, gluten sensitivity are just some of the things that we know can contribute to goiter. You might, if you haven't already watched my nutritional crash course on the thyroid, I talk a lot about the vitamins and minerals that are necessary for thyroid health, many of which the fat deficits can contribute to goiter. So I would encourage you to look at that crash course as well. Let's see here. Do you recommend EAA, essential amino acids, for vegans? If so, how much? I mean, you talking about supplementation of essential amino acids? Yeah, we actually have a product called Ultra Aminos, and it's not so much how much, because part of it depends on what else you're eating. But as a general rule for supplementation, our Ultra Aminos, we start people at kind of just a supportive dose of 2 tablespoons a day of that particular product. But you may need more or less depending on other factors, which I don't have. I don't have those factors where I could comment, but it just depends. But as a general rule of thumb, you should get no less than 1 gram of protein per kilogram of body weight. If you're under that mark, you need to consider supplementing with protein or increasing your protein in other ways. What is the best IV sedation for oral surgery? Versed is known to affect Versed is known to affect memory, and I don't want that. I'm not an expert in. Sorry, I wish I could be more helpful in that regard, but I'm not an anesthesiologist, and I'm not well versed enough in all of the potential different options, especially when you're considering IV sedation. I think one of the biggest issues is if you're going to get IV sedation for an oral surgery, they need you to be out. And they don't want you waking up, and they certainly don't want you to have pain. And so there's a risk benefit to that. It's one of those situations where, talk to your surgeon, and then talk to their anesthesiologist if they're using specifically an anesthesiologist. But if you're going on, if you decide to use that, I could tell you going in, make sure that you have adequate B vitamins going into a surgery where you're doing IV sedation. The B vitamins, oftentimes it's those that are impacted and that create a lot of the memory and super brain fog and fatigue that happens to people when they're coming out, and then even, you know, for potentially for months after, that linger. How much selenium do you recommend? Depends on the person. Anywhere from 200 to 400 micrograms is a decent place to think about starting with selenium supplementation. Simon, you might consider watching our crash course on selenium as well. If I have Hashimoto's and my TSH is normal, but I have a high TPO, what stage am I in? In my opinion, staging is irrelevant. If you have high TPO, it means you have antibodies. What's your level of TPO? You know, if it's generally over 100, you know, that's going to be problematic, despite your TSH being normal. Most of the time, in my experience, what drives high TPO, well, we see a lot of people's TPO normalize when they go gluten-grain-free, Laura. So if you have or haven't, I encourage you to read No Grain, No Pain and follow the 30-day diet. Check your TPO before and after and do a comparative on the diet versus not, and that'll give you a real simple answer. But is it possible to reverse elevations in TPO? In my experience, yes. What will most endocrinologists tell you? It's absolutely not possible. They will tell you that Hashimoto's is forever and that you have to manage it, but that's just not been my experience. I have optimum levels of calcium, magnesium, vitamin D, but going through perimenopause and have symptoms, do I still need to supplement my diet with calcium and vitamin D due to perimenopause? No, calcium and vitamin D supplements aren't necessary just because you're in perimenopause. Because your bone is in osteoporosis prevention, your bone is more than calcium and vitamin D. Those are just many parts of what bone consists of, Larissa. I would encourage you to watch my show from Tuesday. Just go to my channel when you're done with today's Q&A and look up the bone show. But because there's a lot that you can do to prevent osteoporosis beyond calcium and vitamin D. But to answer your question, you know, about specific supplementation, the best way to know what you should supplement with is to test. Test, don't guess. A lot of people spend thousands and thousands of dollars buying nutritional supplements, you know, over the course of their lives, and they're basically peeing their money away because what they're taking is maybe not what they need, or maybe it's some of what they need, but not the things they actually need. And so, you know, if you're trying to really target your supplementation to accommodate your own uniqueness, your own needs, your own biochemistry, it's always better to test. I'd encourage anybody to do testing versus guessing. Do you like the omega-6, omega-3 ratio test to test for inflammation? Omega-6-3 ratios don't test for inflammation, Diana. They test for the propensity to regulate inflammation, but they don't test for whether or not inflammation is actually happening. So if you're talking about testing for inflammation, if I'm asking, does this patient have inflammation? I'm not using omega-6-3 to determine that. I'm using CRP or HSCRP. I'm using ESR. I'm using homocysteine. I'm using ferritin. I'm using TNF-alpha and other markers that can give us the feedback for whether or not there's inflammation. But what the omega-6-3 ratio tells us is we all want inflammation. That's the thing. Inflammation is not a bad thing. It's a good thing. We tear down old cells so that we can repair using inflammation. So think of inflammation as like the housekeeper. It comes in and it cleans the mess so that we can rebuild and repair. And so you want some level of inflammation. If you want to regulate the inflammation so that you don't make more than what you need, that's where the omega-6, omega-3 ratio comes in. And that ratio, 6-3, should be less than 4. So you should, you know, your ratio, if you're looking at an omega test where you're checking those ratios, you're looking for a ratio 6-3 of less than 4 to make sure you're getting enough omega-3. Most people get plenty of omega-6. Omega-6 is abundant in the diet, but it's the omega-3 that a lot of people are lacking. What do you advise for low ferritin? Well, low ferritin is usually low iron, so I would advise an iron panel to confirm. I would probably advise looking at copper as well, copper, ceruloplasmin, to ensure there's not an iron copper issue going on. But typically low ferritin, not always, but typically low ferritin would require more iron. So you could supplement with iron, or you could eat foods that are rich in iron. Liver would be an example of one of the most iron-rich foods that you could consume, but meats are typically where you get the bulk of your iron. So outside of that, you could consider supplementation. Now, there's some iron in some certain vegetables, but one of the problems with iron in vegetable foods is that it's usually bound up by phytates and oxalates, so it's a lot harder to absorb that type of iron. So if you are kind of trying to follow more of a plant-based diet, you can free that iron from the plants up using vitamin C. Vitamin C enhances the absorption of iron from foods that are plant-based. My mom, 75, is losing small bits of teeth. How to prevent it? You got to figure out why. What's happening? She's losing small bits of teeth. She's probably malnourished. Even at 70, you shouldn't be losing bits of teeth at 75. 75 is not, I mean, it's older, but it isn't old. And certainly your dentition shouldn't be eroding to that level. Malnutrition, most likely. I read something the other day that said that both sugar and L-glutamine feed cancer. I know that's true of sugar, but is it really true of L-glutamine? Lots of things can feed cancer. L-glutamine, so can cancer cells use L-glutamine as a source of fuel? The answer is yes, but L-glutamine is also a source of fuel for your lymphocytes. So you have to think about it in context. A lot of people like soundbite information. That's why it's hard for me to do short form videos and content, because the context matters more than anything else. And rambling really quickly that glutamine feeds cancer cells just scares the hell out of everyone from wanting to take glutamine, when the reality is that glutamine, yes, can it feed a cancer cell? Yes. But can it also feed the lymphocytes, which are your white blood cells that mobilize to fight cancer? The answer is yes. So, you have to look at it in that context. I wouldn't have the fear clinically of putting someone with cancer on glutamine, provided we were doing the right things with their diet and their lifestyle and everything else to protect them from progression. So, you'll see the same thing about other amino acids. They'll tell you that, asparagine feeds cancer and that glutamine feeds cancer. And I would say that those people that are telling you that, one, there's never been any human study that shows that supplementing with those things feed human cancers. There's only been Petri dish studies using cancer cell lines to measure whether or not they could use those things as fuel. But cancer cell line studies in a Petri dish are a very different animal than what actually occurs within humans. Again, taking into the context that glutamine feeds white blood cells in humans and human studies. We know glutamine is very important for your white blood cells to be able to do their work. Anyway, hopefully that gives you at least a little more clarity. How does one test the gut microbiome? You get with a good doctor who does the right kind of testing, and avoid any, there's a lot of online microbiome tests that, make all kinds of claims. I won't mention any companies, but avoid them. They are using, predominantly most of those companies are using a technology platform that uses PCR, and PCR is not an accurate way to assess the human microbiome and garner any real relevant information about what you should be doing with your diet or what you should be doing as a whole. Do you have any suggestions for an elderly person who has developed Alzheimer's post many COVID shots? Any special detox? I mean, if that were my mom, I'll just put it like this. If my mom had done that and she was developing dementia, I'd put her on high doses of proteolytic enzyme. We have something called Matrozyme that I would use. It's a product that basically helps to degrade proteins and support blood viscosity. I'd put her on high doses of N-acetylcysteine as a therapeutic intervention for spike. And I would do probably 2,000 to 3,000 milligrams a day and see how well the response was. I'd put her on high dose vitamin C. I'd put her on high doses of omega-3, 2 to 3 grams, simply because I want to make sure the blood flow is running to the brain effectively. And I would definitely make sure to change the diet. And I don't know how much, control you have in the elderly person with Alzheimer's, but if you have the ability to change their diet, change their diet. I have high cholesterol, no high blood pressure, no overweight, no insulin resistance. I'm gluten-free and follow a low-carb diet, meat, eggs, cheese. I don't see the question in it. Is there a specific question, Salvador? I mean, maybe come back and ask a question, or maybe that's just a comment. Yeah, thanks, Mel.
Sorry.
Yeah. Any suggestions for detox to support? Okay, I think I just answered that one. What is EBV, early antigen, antibody, IgG? My labs say it's high. I wouldn't put too much into that. First of all, IgG as an antibody to measure. EBV is Epstein-Barr virus, and IgG is an antibody that people produce, because they didn't delineate what type of IgG in the test. All that really means is that at some point in your life you were exposed to Epstein-Barr virus. It does not mean you have Epstein-Barr virus. It just means that you are making the antibodies that protect you from Epstein-Barr virus. So a lot of doctors that run those tests will try to tell people they have Epstein-Barr, and I don't agree with that. I think if you're looking at IgG, IgG is protective antibody, and that's really all it means. How do I get rid of lipopolysaccharides in my joints? Your body's going to naturally do it. It's not so much how do you get rid of lipopolysaccharides in your joints as much as how do you stop more lipopolysaccharides from inundating your joints repetitively over time. And so you have to go to the source. What is the source of those lipopolysaccharides for most people? It's the GI tract. It's the abnormal bacteria in the GI tract. Remember, lipopolysaccharides are endotoxins made by bacteria that permeate through the gut into the bloodstream and can traverse to the joints, causing joint inflammation. So that being the case, stop the source. That's where microbiome testing comes in, so that you can get clarity around it, how to better handle that. What can you do to help your body clear a chronic viral infection? Look at my immune protocol, Melinda. We put up a link for you. We have an immune protocol that you can follow for a time and see if it's helpful for you. I had 2 gallbladder attacks in the last 2 years. I have stones, but I wouldn't let them take it. In other words, you wouldn't let them take your gallbladder out. Any of your products help dissolve stones? I mean, the best thing to do to support, so when people are having gallbladder stone formation, that could be vitamin C deficiency, that could be taurine deficiency. So those 2 things I would start with, taurine and vitamin C. The other aspect there would be, what are you eating and how are you eating? I see a lot of folks develop cholecystitis, inflammation of the gallbladder, and gallstone issues as a result of gluten exposure. So Vicki, if you're not already on a gluten grain-free diet, strongly encourage you to investigate that. Read my book, No Grain, No Pain. Follow that diet for 30 days. Do a symptom diary as you're on the diet. Do you notice less attacks, less pain, improved digestion? What symptoms do you see, coming or going away as a result of diet change? Because that really is for most people where their gall attacks are coming from. I went on the Mold Jack website. I didn't see anything on how to detox from mold. Yeah, I'm actually knee deep in that project right now, Marie. It's the most comprehensive guide on mold detoxification you'll ever come across. It's just not ready yet. I apologize. We're working diligently to wrap it up here, hopefully in the next 2 to 3 weeks. And we'll have that up on that site as soon as it's ready. As far as things that you can do, there are several things that you can attempt to do. But the number one thing is be out of the mold. If you're in the mold, you're not going to detox from the mold. So being out of the mold has to be your first step. And if that's true, simply you can start on, we have something called mycobinder. That's something we use frequently. We also use lipoic acid. I have a formula for the liver to help biotransform mold toxins. It's called Ultra Liver Detox. So those are just some areas or places you can start. If you have chronic inflammation from being in mold for many, many years, the other thing I encourage people on a mold detox to do is SPMs. SPMs can help to get to a place where the inflammation starts to resolve. So those are just some things you could take away now and potentially start. What are the 6 foods that help glaucoma? There aren't 6 foods. So not trying to sound frustrated, Marika. It's just that so many health influencers and experts are out there saying, eat these 5 foods for this, eat these 4 foods for that, eat these 10 foods for this. And the reality is, there's no such thing as, the set number of foods to, resolve your X disease. So to say, what are the 6 foods that help glaucoma is really, there aren't. I mean, you can eat healthy foods, but one person's food is another person's poison. So, I mean, if I told you blueberries, because blueberries are great for the eyes, but if you read my book, No Grain, No Pain, and read Ginger's story, you would know that Ginger was terminal, and one of the reasons why was she had a blueberry allergy. So it's not such a simple thing to say these 6 foods or these 10 foods, etc. I'm sorry, but that's just the reality of it. If you want to reverse engineer, you want to eat foods that are high in antioxidants and very nutrient dense. And which foods have those qualifications? A lot of whole, real foods fit those qualifications. So that's really where your answer is at. There's not a magic list. Does HRT help you keep bone density? It can, especially if you've had like a hysterectomy, ladies. Exercise helps keep bone density. Nutrients help keep bone density. Motion and movement, not being sedentary, helps keep bone density, but HRT can. Turning 70, it's not too late for you to start HRT if it's the right thing to do. Again, making that determination is a very big decision, in my opinion. I'm not a fan of just, let's put somebody on HRT because we want to protect their bones. I first of all, measure your hormone levels. Have your doctor measure your estradiol and your estrogen and your progesterone and your testosterone and your cortisol and your thyroid hormone, because those major hormones play an interconnected role with each other to make sure that your bones are being supported and being maintained. So it's not always just as simple as take the estrogen, the HRT, and your bone health is better. You really want to get assessed by a doctor that understands this and make some good decisions. I have a friend who recovered from cancer twice, but the last time developed a dry throat and lost his voice. It's been a couple of years and hasn't been able to speak out loud. What can restore his voice? It depends. It depends on what kind of cancer. Did he have radiation to his throat, and was it the radiation that destroyed his vocal cords? That's a big one, Shalene. I don't have enough details to really say for sure. But I've seen people lose their voice due to radiation for cancer treatment on many, many occasions. And fixing radiation damage there's not a list of the top 3 supplements or something like that I can give you. That really requires a personalized approach where you're doing specific testing to help understand what might best help that individual out. I'm gluten sensitive and trying to avoid corn. Is corn-based xylitol safe? I don't recommend it. If you can avoid corn-based products, that's ideal if you're trying to follow No Grain, No Pain. There's plenty of options for birchwood xylitol out on the market. So, that's what I would recommend. Avoid corn xylitol. Can I fix my microbiome if I eat mostly meat and fermented food and probiotics? Possibly. Many people have. It just depends, Lynn. It's hard to say for sure because there's just the unknown context of, when you say, can I fix my microbiome? What does that mean? How is your microbiome broken? Do you not have enough good bacteria? Do you have some persistent inflammation? Are some of the foods that you're eating driving some of that irritation and inflammation? Do you have nutritional deficiencies that don't allow a leaky gut to repair and don't allow your cells in your gut to make enough energy to maintain the mucosal lining? There's just a lot of variability to that question. But if you wanted to attempt doing that, there's no danger in it. And so, a lot of people find tremendous reprieve eating a high meat diet and going away from plant-based foods for a time. That's what the whole carnivore community is about. And, not that I'm an advocate of that diet for the rest of a person's life. I think there are situations where it can be beneficial. I take your ultra creatine, but wondering if you have a protein powder for sensitive GI. I really appreciate your knowledge. Yeah, you're welcome, Margaret. We do. We have something called ultra pure protein, and you want to get the one that has no flavor, Margaret. We have 3 versions. We have a chocolate, a vanilla, and then we have a flavor-free. The flavor-free has no stevia. It has no of the starch component that is in the other ones, the chocolate and the vanilla flavored ones. So it's for somebody with a sensitive GI. It's very, very well tolerable. So that's the one I would recommend that you look for. Let's see here. I am on grain-free diet, but still have loose stool. What else can I do, and how can I heal my gut? So, Hamid, one of the things you could try just immediately if you're still having loose bowels is we have a probiotic called Ultrabiotic Defense. And so what happens is a lot of times the people that are gluten sensitive, they're maybe new to the diet and their bowels are still really irritated. It's because gluten damages the microbiome and it creates the deficit of certain types of bifidobacter and lactobacillus. And so that product is really made to kind of jumpstart the microbiome. And so a lot of people find it very helpful in that regard. But that's what I would recommend. If you were here in my office today, that's what I would tell you to do. My blood test showed creatinine was low. How can I fix that? It may not even be a problem. A low creatinine is not by itself, that lab marker by itself being low doesn't really mean anything. I would need to know, what is your BUN? What is your GFR? These are all markers for kidney function, Layla. And so low creatinine could mean that you're on a low protein diet. That's a possibility. Low creatinine could mean that your kidneys are underperforming. These are things that it could be, but it could also be perfectly normal. And depending on the context of your age and your size and the reference range that the lab is using. So it's really hard to make that determination from just, a low level, generically speaking. My mom, 90, had osteopenia, then osteoporosis. First taking Fosamax improved the bone density, then 10 years, nothing. Bone density got worse. That's about right. Fosamax does not improve bone health. Fosamax causes bones to become brittle and increases fracture risk over time. Got Prolia 3 times, convinced her to stop. Now she's just taking D3K2 and magnesium. Is that okay? It's hard for me to say whether that's okay without the context of other potential complications of her health. But if you're asking me, in my opinion, if getting off of Fosamax is an okay thing to do, my answer is absolutely yes. If I were ever put on Fosamax, I would run as far the other direction as I could. These bone drugs are, in my opinion, very irresponsible and dangerous. That's just my opinion. I know other doctors have different opinions, but you don't fix bone loss with meds because bone loss isn't caused by medicine deficiencies. You fix bone loss with behavior change. And the behaviors that are most important are exercise, sunshine, sleep, clean air, clean water, whole real food that's nutrient dense and nutrient packed. That's where you start. So anyway, I hope that gives you something to chew on. Will you be running any promotion discounts for nutrition testing? I think we're running one, aren't we, Mel? Yeah. So what is that?
Probably INA 10,
INA
10% off.
Yeah. So those of you that are interested in doing our nutritional testing online, if you use the promo code INA10, 10, that's a 10% discount you'll get off that test, which I think equates to somewhere around the neighborhood of $40 or $50, which is a pretty substantial savings. So yeah, so use that coupon code. It's there for you guys to take advantage of. I wish I'd met you earlier. Hashi's all doctors ignored the autoimmune cause. One said the autoimmune doesn't matter. It's just a reason for the hypothyroid. Just treat the hypothyroid. No more endos for me. Yeah, I don't blame you. It's a frustrating world, isn't it? And you have doctors that are so undertrained that there are a lot of them, not all of them, but there's some great doctors. But I mean, it's underwhelming. You know, the outcomes of health in the UK, Europe, and the US, you know, the outcomes are so underwhelming. We have the worst healthcare approach for chronic disease, and not for acute. We have the best healthcare in the world for acute care disease. If you've broken a bone or, you know, fractured something or gotten in a car accident or whatever acute trauma you've suffered, best surgeons, you know, best pain medication, best of the best for the acute care. But when it comes to chronic inflammatory conditions, you know, it's underwhelming in the sense that doctors don't care. They're so overwhelmed by the system that basically promotes the sale of medicines at the cost of the health of the patient who's paying for it, because, you know, most of these healthcare systems are socialized. So your tax dollars is paying for the promotion of mediocrity and underwhelming care. And it's sad. It's sad that we spent last year, I think, $4.2 trillion in the US for shit. I mean, excuse my language, but that's just the honest truth. It's frustrating. And I know a lot of you are frustrated. I'm frustrated right alongside of you because, you know, there's only a handful of doctors who aren't, you know, like entrenched into that system where they're actually out there doing great works and helping a lot of folks. But there's just more people to help than there are great doctors at this point. At least that's my opinion of it all. I can't get rid of candida. Do you have anything that you recommend since I was in mold? I heard this is a contributing factor on why I have and can't get rid of candida. Well, I mean, yeah. So yeah, I have several things that I recommend to support people, you know, going through that. One would be caprylic acid. We have a product, Marie, called Ultra Caprylic Acid. We also have a product called Yeast Shield. And then we also have a product called Biotic Defense with S. Boulardii. Those three things, if we're just kind of throwing basics at you to support your ability to, you know, to balance that candida out, that would be a good place to start. Let's see here. Is it alarming to have high cholesterol in the face of low carbs, 53 years old and physically active? No. I mean, define high cholesterol. Because the goalpost keeps moving, Salvador. We see over the past, so I've been practicing now, and I've seen cholesterol go from 280 to 250 to 220 to 200 over the course of the last several decades. So which is it? What is it? What is high cholesterol? What is low cholesterol? What is normal cholesterol? The goalposts, when they move the goalposts to sell more medicines, because the people moving the goalpost are the doctors on these panels that convene to make these numbers, are basically, they have conflicts of interest with the companies that are selling, you know, statins. And so how do you trust it? So what really is high cholesterol, and when does it become a problem? I would say if you're concerned, depending on how high your cholesterol is, you know, get a doctor to run a Doppler, a carotid Doppler test on you. It'll help you to understand whether or not you have plaquing in your carotid artery. And if you do, you know, now you can think about it maybe a little bit differently. But even if you did, I'm not a big fan of aiming to lower cholesterol for the sake of reversing or preventing heart disease, because the outcomes of doing that over the last 50 years have failed. We don't have less heart disease strokes. We don't have less cardiovascular complications, despite the fact that we've been lowering cholesterol more aggressively than any other time in history. So what does that tell us empirically is that cholesterol as a target to preserve people's health from cardiovascular risk hasn't worked. It just empirically, the data don't show that using these medications are what are absolutely necessary for everybody to do. How can you mitigate hair loss when on creatine? So if I don't want to put words in your mouth, Kim, but what I think I hear you saying is that you're having hair loss when you're on creatine. Because it's my experience with patients that creatine is not a cause of hair loss. So the reason I point that out, and I'm not dismissing that that's happening to you, I'm just not clear. Are there other potential reasons why you might be losing hair? And so one of the things that coincides with people taking creatine sometimes is an increase in exercise, an increase in their workout schedule. So they're trying to take advantage of that creatine to work out better. And if they're not meeting their protein needs, their protein demands with the increase in exercise, hair loss is a complication, but it isn't the creatine necessarily driving that. It's the increased demand on the muscle system for the protein. And remember, hair's protein. So if you're diverting protein from the hair to the muscle to recover from the activity and exercise, then you could have hair loss as well. So maybe I re-ask the question. Maybe your experience is different than my speculation. Can osteoporosis occur only in specific areas, i.e. hips, low back, vertebrae? That has always been one of my fundamental questions, with these DEXA scans, because they're taking readings at the hip and usually the hip and the low back and sometimes the wrist or the heel. And then, comparing you to the standard bell curve, clump of other people in your age range and not in your age range. In my opinion, bone loss, if you've got true bone loss, like I think modern medicine has diseasified osteoporosis with the use of DEXA scans as a means to evaluate bone health, and DEXA scans are junk science. That's just my opinion. I don't think you can measure bone health through a DEXA scan. I think you can measure how many x-rays bone can absorb by using a DEXA scan, but that's not a delineator for bone health, or really for true density, pathological density or lack thereof. You should watch my crash course on bone skin myths. But as a general rule of thumb, could you lose bone density in one area and not another? Yeah, let's say, for example, you broke your arm and it was in a cast for 6 months or 3 months or however long. That bone that's in that cast, it's gonna get smaller. You're gonna lose the density and you're gonna lose the mass of that bone because it's not being used. So you can have osteoporosis in one area, not in another area, if that one area that we're referring to is a more sedentary aspect of your day-to-day. Like, most people use their arms and their hands on a daily basis, but a lot of people sit in a chair or a desk for 12 or 14 hours a day. So their spine's going to be more at risk. Their hips are going to be more at risk, whereas their arms, their upper body may not be, right? So you could have, bone loss in that way. A 71-year-old male to have extreme fatigue. Primary doctor did all the normal tests. Results were excellent. No chronic diseases. Any thoughts? You got to get your nutrition levels looked at, Dale. You can have malnutrition. Malnutrition doesn't have to be a major disease. It can manifest as fatigue, especially like B vitamin deficiencies and other mineral deficiencies, magnesium deficiency. You need nutrients to make energy. And our food supply today is, compared to what it was 30 and 40 years ago, is malnourished. And even if you've been eating healthy and eating whole foods, real whole foods today have less nutritional density than they did 30 years ago. Studies are pretty clear about that. And so this is why checking nutrition becomes so important, in my opinion. But that's where I would start. If you're feeling otherwise well, just minus the fatigue, start with checking your nutrition. I have osteoporosis and a 2, I'm assuming you mean centimeter kidney stones. Yeah, you got an oxalate problem. If you get the, Deborah, get the stones evaluated for content. If you pass them, take them, capture them, get them tested. They're probably calcium oxalate stones. If you have high oxalates for some people can drive bone loss. Oxalate bind to calcium and prevent calcium absorption into the bone, among other things, but it's a possibility. I got a paralyzed vocal cord from a flu shot and acupuncture helped. Thanks for sharing that. I think there was another question earlier about the vocal cords or the speech. And so, yeah, acupuncture, my wife did acupuncture for years. She doesn't practice anymore, but my experience was always that acupuncture really worked really well or didn't, but it worked really well for a lot of people. My son is 10, gets frequent sneezing and fungal infections. He eats healthy, mostly salmon, chicken, beef, vegetables, and takes omega-3 probiotics, vitamin D, and multivitamins most of the time. That's good, but if he's getting frequent fungal infections, you may be in mold. Your environment may be moldy, and that may be why that's happening to him. So, you might want to look into that. Sorry you lost your dog, Melinda. I'm positive for mycotoxins. If I take your mycobinder, will that be all I need besides the diet, gluten and grain-free? I'm out of the moldy environment. Great. I'm glad you're out of the mold, Anna. I'd use mycotoxin. I'd use the mycobinder, but I'd also use ultra liver detox, and I would also use NAC, N-acetylcysteine, and I would also use lipoic acid, like as a starting point. You also might consider probiotic. We have one we like to use for mold, post mold, and that's Biotic Defense with S. boulardii. Because a lot of mycotoxins are antibiotics. So as you're inhaling them and they're coming in, they're knocking out your microbiome. So what we're trying to do is put healthy bacteria in. Some of the mycotoxins are actually broken down by the bacteria that live in your GI tract if you have them. So that's the logic or the reasoning behind that. What causes the pain in the joints with autoimmune conditions like lupus, Sjogren's, Hashimoto's? I have been diagnosed with all three. You probably, if you went to a rheumatologist, you'd probably get a diagnosis of rheumatological arthritis too, Darla. It's most likely an autoimmune reaction. It's hard to say for sure, without having some type of objective confirmation of that, but it's very common. Those diseases all have overlap. The autoimmune conditions all have tremendous overlap, and rheumatoid fits in the family of lupus. Lupus can also, autoimmune reactions to the joints as well. If you haven't started No Grain, No Pain, do it. Jump on it. You'd be amazed. Go check out some of the go to nograinnnopainbook.com. That's the website for the book, and watch some of the video testimonies of people following the diet. It'll blow your mind. I mean, people going into full remission of diseases they were told were impossible to go into remission for. People stopping their medications and still being healthy and being asymptomatic because they changed their diet. Diet change can be life-altering in a very good way. But a lot of people they got to overcome that mental hurdle in their mind of the fact that diet is important. Because a lot of people, and I'm not saying you do, but a lot of people have a tendency to self-victimize. They get the diagnosis, and then instead of saying, what can I do to empower myself to get better? They say, poor me. I'm so unlucky. I have such terrible genes. I'm going to be on these drugs for the rest of my life. Because that's what their doctors are saying, right? It's really the fault of a lot of the doctors that treat these things, because that's the message. It's, let's take away your hope and let's put you on management. And I don't believe that's a right thing to do. And I've seen too many cases. I've seen over 10,000 people in my career, and I've seen so much autoimmune disease go into remission with diet and lifestyle, and you'll never convince me otherwise. What are some tests to actually evaluate bone integrity? mean, you can do a DEXA, but don't do a DEXA and that's all, right? DEXA gives you some context, but that's it. Beyond that, you would be looking at osteocalcin, deoxypyridinoline, intellipeptides. These are all markers that can be measured that help you understand how fast your bone is breaking down versus comparatively how fast your bone is building. But to me, the most important test is nutrition testing, because your bones are made of nutrients. And if your nutrient levels are low, then you're putting your bone at risk. And so knowing, what nutrients you need and how to eat more of those nutrients in your diet and potentially supplement with those nutrients, to me, is the most important thing you can do if you're trying to really prevent a bone issue. An ounce of prevention is a pound of cure. What causes clicking or popping in the knees upon movement? Lots of things. It could be oxalatic, but it could also be just tightness, normal joint crepitus, could be deterioration of the cartilage, depending on how old you are and if you're overweight or if you're not overweight. I mean, there's just a lot of factors in the popping. Some popping is relatively benign and not anything to kind of worry about, but grinding would be another matter. So it kind of also depends on the type of sound. Okay. Well, I think we're it. I think we're up on the hour. So I want to just say thank you guys for tuning in. I'm sorry we had tech issues yesterday, but appreciate you hanging in with us to come to the show today. We'll be back on Tuesday with another fantastic crash course for you. That's going to be at 6 p.m. Central Standard Time. So mark your calendar. Don't miss it. If you want to get notifications, you can, if you're on YouTube, you can hit that like button. You can also hit that subscribe button and then click the bell icon next to it. And, you do that, supposedly YouTube will send you notifications, although we've had reports that many people aren't getting our notifications. That's one way to not miss the next show. Now, the other way to really not miss the show is to go over to glutenfreesociety.org and sign up there for our newsletter. We send out reminders pre-show every week so that you don't miss an episode. We even give you information, coupon codes, and discounts and other special educational materials that you can follow along with the show with. So we do, slides that we send out and everything else. So go over there to get that information if you want to stay up to date with us. Thanks so much for tuning in. I hope you all have a fantastic weekend. And to all the fathers out there, happy Father's Day. And we will see you next week. Take care.